Good morning, everyone. Thank you for joining us on this Friday morning. We are very happy to be presenting a webinar regarding the university's vaccine requirement and are very honored to have two of our NYU community members who are joining us this morning. We have Dr. Carlo Ciotoli, who many of you know, and you've heard from him throughout these many months that we've been dealing with COVID. Very thankful and grateful to him for his leadership at NYU. He is the Associate Vice President for Student Health and also the Executive Director for the Student Health Center. And we're also joined by a NYU faculty member, Dr. Aisha Langford, and she is an Assistant Professor of Population Health at NYU Langone Health, also Grossman School of Medicine. So I'll turn it over at this time, and thank you again for joining us.
All right, good morning, everyone. Let me just pull up my slides here and we will get started. All right. Many of you know me, not so much in my role with student health, but more broadly leading the COVID prevention and response team over the last year plus. And what we'll do today is go over a little bit about the vaccines themselves so that everyone can make good decisions about whether or not they're going to choose to get vaccinated, but hopefully we'll present a compelling case for vaccination. Today, I'm largely using information pulled from the Centers for Disease Control and Prevention, the Food and Drug Administration, and just want to remind everyone that the information that we present today is really for informational purposes only and not medical advice, and that we would ask that you consult with your personal healthcare provider to seek and receive any medical advice, as everyone's situation might be a little bit different. We've done quite a bit over the last year to be successful. We brought back students. We had at least some in-person presence over the last academic year because we did all the things that we were supposed to do. We wore masks, we distanced, we washed our hands, we checked our symptoms, stayed home if we're sick. And now we have the opportunity to do one more quite powerful thing to help stop the spread of COVID-19, which is to get vaccinated. And again, we'll spend some time going over the benefits of getting vaccinated. As we know, COVID-19 can be a very serious illness, and getting the vaccine helps you avoid both getting the disease and spreading it to others. It helps keep you from getting seriously ill, even if you do get COVID-19. And it means you're less likely to go to the hospital, be on a ventilator, or even die. It protects you, the people around you, including people at increased risk for severe illness from COVID-19. We know the vaccine is safe, and I'll show some data around that. We know the vaccine is effective, and I'll show data around that. And the vaccine is free. Everywhere you're able to get the vaccine, you can get it at no cost. So how do vaccines work? How does the COVID vaccine work? The vaccine helps your body develop immunity to the virus that causes COVID-19 without you having to get the illness. And we've gotten many questions, and we'll touch on some of them at the end, about people who say, well, they'll just get sick, they'll be immune at that point. But at this point with the Delta variant, it is a more severe, we believe, form of the virus. And the truth is, we actually think the vaccine provides even better immunity than getting the infection itself. The vaccines contain material that teaches your immune system to recognize and fight the virus that causes COVID-19 if you are subsequently exposed to the virus later. One important thing to remember is that it takes 2 weeks after vaccination for your immune system to build up the cells it needs to protect you. And when we talk about being fully vaccinated, we mean it has to be 2 weeks after your second dose of either the Pfizer or Moderna vaccine, or two weeks after your single dose of the Johnson & Johnson vaccine. We'll talk about side effects in a minute, but most of the common side effects after getting the vaccine simply show that your body is working to build that immunity. One important thing I do want to highlight, we hear this about the flu vaccine, we're hearing it about COVID, and again, just to clarify the point that you cannot get COVID-19 from the COVID-19 vaccine. The 3 FDA authorized vaccines do not contain either live or inactivated COVID-19 virus, so there's no risk of becoming infected with COVID-19 by receiving the vaccine. There are 3 currently available vaccines in the US that have FDA emergency use authorization. Those include the Pfizer and Moderna vaccines, which, as you know, are what we call the mRNA vaccines. And then there's the Johnson & Johnson vaccine, which uses a different type of mechanism to generate immunity. The other difference, as we've highlighted, the Pfizer and Moderna vaccines are a 2-shot series, 3 and 4 weeks apart, and the Johnson & Johnson is a single-dose vaccine. So one of the questions I know that comes up often is that people are hesitant to take the COVID vaccines because they felt under emergency use, they somehow were not tested in any formal way. And that's simply not true. All of the vaccines, the 3 I mentioned, that have emergency use authorization went through formal clinical trials where data was collected and reviewed on how safe the vaccines were and how effective the vaccines were. And I did want to take a couple of minutes to go over that process because I do think it is important. In clinical trials, whether it's for a medication or a vaccine, the very first thing they do is to evaluate safety. They do it in small numbers, and they're not looking for effect. The very first thing they want to make sure of is it safe? Again, whether it's a medication or a vaccine. Once they establish that it's safe in the doses they plan to use, they move into phase 2 trials, where they then begin gathering information still on safety, but then how effective it is. And during phase 2 trials, they'll also begin to look at different dosages to see whether or not there's any difference in the effectiveness of the vaccine at different dosages. And they'll continue, again, to monitor for reactions and side effects throughout phase 2 as well. When we go into phase 3 trials, we then begin to look at larger numbers, perhaps thousands, and I believe the vaccines were tested in tens of thousands of individuals, where you now compare who got sick and who didn't, and the side effects in groups that got the vaccine, volunteers who got the vaccine, and those who didn't, so that you have a group to compare to at a similar point in time. And those 3 phases, the data that gets collected from those 3 phases is what gets submitted to the FDA for the emergency use authorization. Now, subsequent to that are what are known as phase 4 studies, where they continue to look at the safety, the duration of protection. I know a lot of questions have come in about boosters and side effects. So I just want to make the clear point that the vaccines do get formally evaluated for both safety and effectiveness. So just these are the results of the, oops, let me just go backwards here. The results of the phase 3 testing. And this was done during 2020. So this does predate Delta virus. But you can see the results of the Pfizer and Moderna vaccines somewhat similar. The Pfizer vaccine being 94% effective against symptoms, 100% effective against death during those trials. The Moderna vaccine, 95% effective against symptoms, also 100% effective against death. The Johnson & Johnson vaccine, which we again said was single dose, 72% effective against what they termed moderate to severe illness, 100% effective against death. And this graph just highlights in a way that I think is a little easier to see. On the bottom, you can see days from randomization. That means the point at which one group got the vaccine and another group got placebo. That the number of people who actually got sick significantly went up over time, whereas those in the vaccine group, there was very little increase, almost, again, at exceptionally low levels, again, reflecting that roughly 95% effectiveness of the mRNA vaccines. So were the vaccines made too quickly? That's another question that comes up. And I think the short answer is no. The methods used to make the vaccine had been in development for decades before the COVID-19 pandemic started. So it gave scientists a bit of a head start in using those methods to make a vaccine for this novel virus, the COVID virus. They had to go through, as I described, all the steps of testing that are required for any other vaccine that are used in the US. And based on all available evidence, they're as safe as any other vaccine. And no steps were skipped in the vaccine testing. Now, people wanted to know, again, about some specific issues, and I did want to address, I think, some of the myths around some of the things that I've read about, seen that have come up regarding the FDA-authorized COVID vaccines. There is currently no evidence that COVID-19 vaccinations causes any problems with pregnancy, including the development of the placenta. In addition, there's no evidence that female or male fertility problems are a side effect of any vaccine, including the COVID-19 vaccines. COVID-19 vaccines do not change or interact with your DNA in any way. The vaccines, as I said before, will not give anyone COVID, nor will they make anyone more susceptible to getting sick from COVID. As we said before, it is the opposite. They make you less likely to get sick, less likely for you to get severely ill. And the vaccines themselves do not contain any fetal tissue. What about side effects from the COVID-19 vaccine? As I said before, side effects are a normal sign, generally, that your body is building immunity. And there are a host of side effects that are relatively common to all the COVID-19 vaccines. And that includes soreness or redness around the injection site, low-grade fever and chills, feeling tired, joint or muscle pain or body aches, and headaches. Now, there are some rare side effects that are also potentially related to the vaccine that have been identified with both the Johnson & Johnson and the two mRNA vaccines. So with Johnson & Johnson, there was a somewhat serious but rare side effect that did cause a temporary halt of the Johnson & Johnson vaccine related to clots. Now, the FDA and the CDC reviewed the data and determined that the vaccine was safe and effective and recommended that the use of J&J vaccine resume. For Pfizer and Moderna, more recently this spring, there were reports of mild cases of inflammation of the heart or the lining around the heart called myocarditis and pericarditis happening after the mRNA COVID vaccines were given to certain individuals. Again, these were rare case reports occurring mostly in males and young adults, 16 and over. The onset was typically within several days after vaccination, and cases occurred more often after the second dose than after the first. The CDC again reviewed the available data on those cases, and they showed that most patients who received care responded well to the medicine, and rest, and quickly felt better thereafter. Now, we've talked a lot about side effects, the common ones, the less common ones. In most cases, discomfort, pain or fever is a normal sign that your body's building protection. But you should contact your doctor or healthcare provider if the redness or tenderness where you got the shot gets worse after 24 hours, or if your side effects are worrying you or do not seem to be going away after a few days. Now, if you do get a COVID vaccine and think you might be having a severe allergic reaction after leaving the vaccination site, you should immediately seek medical care by calling 911. That is rare because we know that most severe reactions happen within the first 15 minutes, which, as many people know, you are asked to wait 15 minutes at the vaccination site to look for those severe reactions. In summary, the CDC, even with reviewing, and the FDA reviewing all the new data around potential side effects, continues to recommend the COVID-19 vaccination for everyone 12 years of age and older, given the greater risk of COVID-19 illness and the possible severe complications from COVID relative to any of those other side effects. So what happens when you go get your COVID vaccine? You'll get a shot in the muscle in the upper arm of your choice. So often people will pick their non-dominant arm so that if they're right-handed, they will often get it in their left arm. As I said, you'll be observed for at least 15 minutes before you can leave. Again, largely to watch for any sorts of reactions. You'll get a card that states the name of the vaccine manufacturer, the vaccine lot number, and the date and location where you got the vaccine, which is important for subsequent documentation purposes and validation. And then you'll also, after the first dose, receive instructions on when you should get your second dose if you got either Pfizer or the Moderna vaccine. So for those two vaccines where you need a second dose, people often ask, do I really need it? Will I get enough protection just from the first? You really do need to come back for that second dose. Again, 3 weeks if it's the Pfizer vaccine, 4 weeks if it's the Moderna vaccine, to be protected adequately. Without it, you won't have enough protection, or your protection might not last as long. And again, you might not be protected against newer forms of the virus that might circulate now or in the future. As I've said before, J&J is only a single dose. I do want to make note that if you did have a severe reaction, an allergic reaction, what we call anaphylaxis, after getting the first dose of the COVID vaccine, the CDC recommends that you not get a second shot of that vaccine and have a conversation with your healthcare provider. I want to talk a little bit about herd immunity because I know it's come up in the questions. We are trying to get as many people vaccinated as possible. And herd immunity is where you get a majority of the population immune to a specific illness that then protects everyone. The more transmissible the illness is, the higher the level of vaccination you need to develop herd immunity. And less likely to spread within the population. So for us, I think we're all trying to get to that level of herd immunity that will help end or at least slow the pandemic significantly, open up more opportunities for regular interactions, get society back to normal, and protect the most vulnerable members of our community. And as I said before, the more transmissible the illness is, the higher the level of vaccination coverage that one needs. And what we're seeing now with the Delta virus is that it is highly contagious, much more so, I think, than we even thought, which is why I think we're looking for as high a level of coverage as we can absolutely get. A lot of discussion about variants. There have been multiple variants since COVID first emerged, and viruses mutate, which means they change constantly. These new mutations are called variants. Sometimes a variant is actually either deadly or makes the virus less transmissible or less severe, but sometimes it makes it more transmissible or more severe. And these variants tend to persist and spread. So the virus that causes COVID-19 has had, as we all know, many recent variants. And the CDC categorizes them different ways. And variants of concern are any that can do one or more of the following. They spread more easily or more quickly. They cause more severe disease. They can evade antibodies from vaccines or from earlier infection. They better resist certain medications that we have. And they potentially can avoid being detected by COVID-19 lab tests. Now, I will say that the studies continue to show that the currently available vaccines, the three that I've mentioned, are effective against current variants, including the Delta variant. Just a couple of key points. I think we've seen the vaccines are safe and effective, that people will get side effects, mild side effects, but those are normal, that it takes 2 weeks after you receive all the doses for the body to build protection or immunity against the virus that causes COVID-19. They are now widely available to those 12 and older. People who have been fully vaccinated can start to do some things that they had stopped doing because of the pandemic. I think we've seen this week the mayor go on record as saying he anticipates more and more vaccine-only type of events and gatherings. I know a lot of questions have come up and the guidance is evolving rapidly on the issue of mask mandates and what to do if you're vaccinated. I will say at NYU, we have continued with our indoor mask mandate, whether you are vaccinated or not. And I anticipate that guidance continuing at least for now. And then just, I want to end my portion by saying that the vaccine is widely available. There are a host of places to get them. Most of the retail pharmacies have it, but you can look either at a New York City specific vaccine finder or one that is even national. And if you live outside the city, you can find vaccine that way. But again, readily available at this point. So thank you. I'm going to stop and turn it over to Dr. Langford at this point.
Okay, great. And I'm going to share my screen. Can you see my screen okay? Hold on one second. Just make it larger. Oops. Can you see my screen okay? Can you all hear me? Can you just give me a thumbs up if you can hear me? Okay, great. So I'm really excited to be here with you all today. I should give, I guess, a disclaimer. I actually am a participant in Pfizer's phase 1 clinical trial. So as he was talking about the different phases of clinical trials, I was literally one of the first people, I guess, in the world and at NYU Langone's clinical trial site for the Pfizer phase 1 trial. So I am still in the trial. I got my vaccine, my Pfizer shots in July of 2020. So I guess about 5 months or so before most of the United States were able to get the vaccines through emergency use authorization. And I'm doing fine. Actually, one of my community members said, what if you drop dead from this experimental vaccine? And as you can see, I'm fine, I'm healthy. And I actually chose to get the optional booster shot through the clinical trial in March. So they are following us to look at durability of the vaccine and efficacy of the vaccine. So I'm a participant and contributing to the research, and I'm really excited about that. So I'm just going to spend a couple of minutes talking about misinformation. And I don't know if you all remember in March of 2020, right, when we were starting to really be concerned and think about COVID, there were a lot of text messages going around. I saw many of them. They were posted on, these stories were posted on Facebook about someone's aunt has worked somewhere and has firsthand knowledge of what's happening with COVID. And this is a very common way to actually spread misinformation. And ironically, I actually got a text message from one of my family members earlier this week on Monday. And I got one of these things that says, from a healthcare professional. And this is a very close family member. And I called them and I said, okay, who is this health professional, right? So usually if you get something like this, the first thing I want to ask, well, was forwarded by a health professional. Who is it? Where do they work? What are the credentials? Why are they qualified to tell me this? And is this information actually correct? So there are some elements of truth in this text message, but a lot of it is actually false. Also, I didn't see any reference to any links or any information that I could actually verify. And another telltale sign of misinformation that is often spread through text messages and other things posted on social media is that the last line is, don't keep this information to yourself. Share it as much as you can, especially with family and friends. So these are just components you want to think about. I think we all have a responsibility to make sure that we are not sharing misinformation. And so if you haven't read it and you can't verify it, please do not share it. You also may be aware that on July 15th, so just a couple of weeks ago, the Surgeon General actually issued a warning about the pervasiveness of misinformation in the United States. And really, it's a call to action for healthcare organizations and community members and people just like you and me to really help stop the spread or slow the spread of misinformation. One of the reasons that misinformation is so pervasive and really difficult, I think, sometimes for people to distinguish what is true, what is fake, what is concerning, is this idea of health literacy. So one definition of personal health literacy from the Healthy People 2030 is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And so let's think about, like, what does that actually mean? How do you, when you see something or read something on the internet or in the newspaper, what is your process for determining whether or not it's legit and valuable? So when I'm teaching classes and talking to my own social circle, I like to remind people to think about, so this is a checklist from Medline Plus. And one of the things I always ask is, who's in charge of the website? Can you contact them? Is there a phone number? Is there an email address? Basically, who is behind the website? Is it a university? Is it a health department? Is this some person who got a disease and is only sharing their testimonial about their unique process? Or is it someone trying to sell you some miracle cure? So typically, if you see something that says, for $19.99, we can cure COVID and, all of your social problems, it's probably not legit and probably too good to be true. So if it looks too good to be true, it probably is. Many of the more reputable websites will have a statement about how the website is funded, where the money comes from to support the website. So those are also things that I like to look for. Depending on the website and how it's run, it might say these funds or this website is supported in part by a grant from the National Institutes of Health. It may come from donations or from the healthcare organization, but I always like to know the money behind the website. Also look for advertisements, and typically websites that I refer family members and friends and patients to typically don't have websites, but just because typically don't have advertisements. But if there are advertisements on the website, they should be clearly labeled as advertisements or sponsorships. And then in terms of quality, I always look for, who is writing the content. Are there references around where the information actually came from? So do you literally see citations and references at the bottom of the page? Do they have an expert panel that reviews the information? So typically many legit websites will have an editorial board, and you can see who's actually on that editorial board. And then I would say really, really, really important thing to look for is a date. So as you know, the information about COVID is rapidly evolving. And so if you go on a website and the information is from April of 2020, well, a whole year and some months have changed. A lot has happened since April of 2020. Frankly, a lot has happened in the last month or so. So I always like to look at, is there a date when the information was updated. And then last but not least, really think about the privacy implications. So if a website is asking for your personal information, like your email, which is not necessarily bad because you may want to get on their newsletter or whatever, they should have a statement about how that information will be used, if they sell your information, and if you want to be removed, how you can be removed. And so just to think about, are you comfortable with however that organization is going to be using your information? And so these are some of the things that I would have my family and friends and community members, if I was doing a workshop, look for. One question that comes up quite a bit when I'm on these types of town halls, and I think I've probably done about 20 or 25 so far in the last 5 or 6 months, is should people take vitamin D and herbal supplements to prevent or treat COVID-19? So to date, there is no evidence that vitamin D by itself will prevent COVID or cure COVID. However, we all know that vitamin D is actually very important and good for your bones, and vitamin D does play a role in your immune system functioning. So if you are concerned about your vitamin D levels, before you go out and buy a whole bunch of supplements and just start ingesting things, it's really a good idea to talk to your healthcare team and to get a blood test to see if you are actually deficient in vitamin D. And if you are, you can work with your healthcare team to determine what would be a safe level of supplementation for you. It's also important to remember that you can also get vitamin D from the sun and also from food. The issue of herbal supplements also comes up quite a bit. And I think sometimes people think that just because something is quote unquote natural, that it's not harmful. So there are some herbal supplements that can actually interact and be harmful, especially if you're taking over-the-counter medication or prescription medication. And some herbal supplements have actually been shown to damage your liver. So if you are thinking about taking herbal supplements or currently taking herbal supplements, just talk to your healthcare team so that whatever you're doing or thinking about doing can be done as safely as possible. I will also just want to put in a plug. Pharmacists can be very, very helpful here. And so again, herbal supplements, even though they claim to be natural, they still are chemicals and things that you're ingesting. So it might be a good idea to also consult with a pharmacist or a registered dietitian if you're thinking about either vitamin or herbal supplementation. And then my second to last slide is really about how to talk to family members and friends about COVID-19 vaccines and hesitancy. There's so much uncertainty and fear and just misinformation out there. So I think I just want to remind all of us to just take a step back and to be kind and non-judgmental as possible. Listen with empathy, ask open-ended questions. And those are really questions that basically can't be answered with a yes or no, to really explore what the person's concerns are. Some people may be concerned that they're actually going to get a bill, and other people may be concerned that they have a healthcare condition that maybe wasn't represented in the clinical trial. So everybody's reason for being concerned and hesitant is different. Number 3 is really important. Before you start sending your, Uncle Bob a whole bunch of information and trying to educate them or him, ask permission if it's okay to share some information, and really to think about helping people find their own reason to get vaccinated. So I'm very biased. I have 2 degrees in public health. I think everyone should get vaccinated so they don't die and get sick or make me sick or someone I love sick. But maybe people have other reasons for getting vaccinated. And then number 5, there may be some logistical ways that you can support people getting vaccinated. So they may not have a ride to a vaccination center, or maybe they need childcare for the day, or maybe they're concerned about the side effects. And if you say, hey, if you need anything, I'm around this weekend. If you need me to, do anything for you, I'm happy to help the day or 2 after you get vaccinated. That might help some people be a little bit more comfortable in being able to get their vaccines. In terms of finding and recommending reliable sources of health information, these are some websites that I would recommend. If you're not familiar with Medline Plus, it's an excellent website and it has information about COVID, but a lot of other health conditions, herbal supplements, yoga, nutrition, healthy eating, and a lot of different languages. And it's really meant to be in plain language and very user-friendly. And of course, the CDC and the World Health Organization. And if you have family members or friends or community groups that may not want to read a very long article from the CDC or the New England Journal of Medicine, there's also Hiphop Public Health. And this is a website and an effort that was created by Dr. Aisha Williams, who's at Columbia University. He's a nephrologist by training. And there's lots of really short, fun videos about COVID-19 and other health issues. And they, the physicians and the clinical staff work with hip hop artists and singers and people in the entertainment industry to deliver health education in a way that's fun and a little bit more palatable than reading like a long, brochure about a health condition. So thank you so much. And that's all I have for now. And I look forward to our discussion.
Great. And Dr. Langford, did you have any specific questions that you wanted to address that were outside, that didn't get addressed in the presentation?
I'm just looking at this right now. So I'm just pulling it up. I think I covered most of them. One of the questions was that if people have a preference for a particular brand of vaccine. So the two websites that you shared on the Vaccine Finder, especially the one in New York City, you can actually tell which pharmacies and which healthcare systems actually have which vaccines. So for example, for whatever reason, my brother wanted a specific vaccine. And so he could look to see which places had a particular vaccine. So you can find that on these vaccine finders if for some reason you have a preference over one brand or the other.
Great, thank you. All right, I am going to now, and thank you everyone who submitted questions beforehand. We got quite a few. I may paraphrase some of the questions because several were thematically grouped. But I'm going to start with a question around pregnancy, and it's sort of multi-part. One question asks whether those who were pregnant or seeking to become pregnant were formally included in the vaccine trials, and what were the results of those. So I will say in the initial vaccine trials, they did not enroll individuals who were pregnant. But those trials are now underway, and additional are being initiated where they're actually recruiting pregnant individuals to look specifically at that. I will say that the CDC still recommends vaccination for pregnant women, in part because pregnant women are at increased risk for severe disease. And within the clinical trials, there were those who subsequently got pregnant and they were able to follow them after the fact. So the recommendation right now is that experts believe that the vaccines are unlikely to pose any risk for pregnant individuals, and that they continue to recommend, based on the benefits of the vaccine, that pregnant women do get vaccinated. Again, the data that they collected both during the trials, but even subsequent through the various safety monitoring systems, did not identify any safety concerns for pregnant people who were vaccinated or for their babies. So the CDC is still recommending vaccination for pregnant individuals. Another question that has come up, and Dr. Langford alluded to her optional booster. The question was, with new variants emerging, will booster shots and/or annual shots be on the way for those already vaccinated? And then will the NYU community be mandated to take those too? So there is data that's still being collected. Both public health officials, the various vaccine manufacturers are all looking at that data. I think the one group where it is looking more likely that there is a need for boosters are those with whose immune systems might be for whatever underlying medical condition, a little bit compromised. So that is one group that is more than likely to require a booster. There are questions about whether or not we need to boost at some point in the future. It is certainly possible. As I've said, data is being collected, no decisions yet. The CDC and the FDA have come out with a joint statement, at least right now, that fully vaccinated Americans do not need a booster shot at this time. That could change. And certainly for us at NYU, the question of will we, within our community, be mandated to take that shot as well. I think we'll have to see what the guidance is, what the public health landscape is at the time before making a decision on booster shots. We got a series of questions related to COVID antibodies, to prior infection, the need to get vaccinated after having had prior infection. So I want to go over that a little bit as well. Again, there's a scope of questions around that, but the current CDC recommendations are that even if you have had COVID before, that you do receive the vaccine. And that there's data that is pretty compelling that those who do get vaccinated after having had the illness are better protected, particularly against the Delta variant. There is emerging evidence that natural immunity, that is after having had COVID with a prior variant, is not as protective as the vaccine is against the Delta variant. So I think there is a compelling case to be made to getting vaccinated, even if you've had COVID in the past. There is also some data that suggests the duration of immunity is longer if you get vaccinated. So again, I think there is compelling evidence that getting vaccinated after having had COVID is the right thing to do and is the current guidance from the CDC.
Can I interject?
No, absolutely.
There's also several questions that I've been asked a lot about like the long-term effects of these COVID-19 vaccines. And yes, it is true that the COVID-19 specific vaccines are new, but the technology behind them is not new. And for most vaccines, if there are going to be any side effects, and this is really for all types of vaccines, that usually happens within the first 2 months of actually getting vaccinated. And as you know, we are now going into several months and almost over a year of the COVID-19 trial. So I just wanted to bring that up, that the idea of long-term effects is theoretically possible, but just historically speaking, side effects usually show up within the first 2 months. And we do know that there are real side effects of actually getting real COVID. We know for sure that over 600,000 people have died. We know for sure that people who've had COVID can have long-term symptoms or long COVID, and that could be brain issues, cardiac issues, pain. I have a dear friend who got COVID who now has scar tissue in his lungs and still has difficulty breathing after, recovering from COVID over 7 or 8 months ago. So we do know that there are very real side effects from actual COVID. So I just wanted to throw that in there.
Absolutely. Thank you for interjecting. And I know that comes up with the question of what's the difference between emergency use authorization and full approval. And it is really sort of more a time frame issue. And I think people have to remember that at this point, over 300 million doses of COVID vaccine have been given to over 160 million individuals, so that we have a lot of data about certainly at least a year and a half's worth of data. Some of the people who are in the initial trials now are well over a year post-vaccination. So there is a fair body of evidence to the point that Dr. Langford made, that the side effect profile, if there were going to be side effects, I think we would largely know. And some have come up that we have described, but again, still paints the picture of weighing on the side of the tremendous benefits, which we know, versus theoretical risks on the other side. So thank you for that. And then just to go back to the questions around antibodies, one thing that I think is well established is it's a little unclear that simply doing routine antibody testing is a predictor of how well you are protected. So that people, public health officials, do not recommend simply having your antibodies checked to see if you are immune or not immune. So I wanted to highlight that point as well. I'm still going through some of the pre-submitted questions here. The next one is, why is mandatory vaccination necessary when New York City has already achieved herd immunity? So two parts to that. The first is, by probably no measure of herd immunity has New York City reached herd immunity. I think at last count, New York City, the population was actually, I believe, across the board, less than 60% fully vaccinated. So that would be well below any herd immunity level that I think we need for COVID. I think what people might be perhaps misinterpreting was that if you remember, at multiple levels, the federal government, I think even at the state level, there was this discussion when 70% of adults had at least one dose, we would begin to open up and loosen restrictions. So the state got there, but having one dose of a vaccine in only adults does not equal herd immunity. So certainly, I think around the question of why is mandatory vaccine necessary, I think for us to achieve that level of herd immunity, it was critical to get to a significantly higher level of immunity than we knew the rest of the community was getting at. So I did want to clarify the point that New York City is certainly not at herd immunity. And I think we can see throughout the country, in parts of the country that have lower levels of vaccination coverage, that the Delta virus is in fact driving case counts up rapidly. And there is a pretty good inverse correlation between vaccination coverage and rising case counts. Obviously, the higher the vaccination rate, the lower the rise in case counts, the lower the vaccination rate, the more rapid rise in case counts. So that's a question on herd immunity. A little bit tied to this is NYU attempting to achieve herd immunity within its own community. How important or not is it? And I think just from a pure public health point of view, it's obviously critically important to get the highest levels of vaccination coverage that we can. Again, Dr. Langford talked about how much things change and how much they have changed since last year, over the last month. And even this week, each day, the CDC is now pushing out additional guidance and additional information about the Delta virus, which I think only highlights how important it is for the entire community to be vaccinated. I'm going to take two questions together. One is, what is the plan if the virus returns? And I will say it hasn't left. And then the second question that thematically I think falls a little bit under the same category, which is, what will the fall semester look like now that there's a Delta variant and fall is flu season? So I think one of the things that we've done since the beginning of our planning is always to create flexibility in that plan, because we don't know what will happen. Flexibility around our policies, including mask wearing, flexibility around our surveillance testing protocols. As you know, we had all members of the community test before. Now we're only asking unvaccinated individuals to test, those who have exemptions. So we certainly will be able to maintain enough testing capacity that if we were to decide to change that, because we feel that's warranted, and the evidence and the guidance changes, that we would have that. We will continue to look at the nature of the activities that we have on campus and how we conduct them. So again, we have always had flexibility in our approaches that allows us to become either more or less restrictive, impose or lift certain protocols. And I think we would continue that certainly throughout the rest of the summer and into the fall semester. Let me pause and just see, Dr. Langford, if anything's come in through the chat that you wanted to answer.
So I've responded to a couple of questions. There are a lot of questions and concerns, but someone asked about how the different vaccines work. So mRNA versus viral vector vaccines, which is what Johnson & Johnson is. So you can go on the CDC website, usually put a link in there. And what else? I think that, oh, and then another, I did put in a link about long-term effects, what we know in the context of other historical vaccines and why typically if there's going to be any side effects, it will be in the first 2 months. There's a link there if you want to read more about that as well.
Great, thank you. Then there is a question, I know, I believe this came up in the chat potentially, but it was a pre-submitted question. There are individuals who live in parts of the world, primarily our international students, that don't have access to vaccines, or at least ones that are WHO listed. For our requirement at NYU, we're accepting either the 3 US FDA approved vaccines or any that are WHO listed. So I know international students in particular from countries that do not have access to WHO listed vaccines are concerned what will happen. So there we're encouraging those students, if they can, to arrive early. As we've stated, I think several times before, there are ample opportunities to get vaccinated. We will, by mid-September at the health center, reopen our vaccination clinic for COVID-19. I was reassured by the Department of Health that there is ample vaccine that would be made available to us. And while you will not be fully compliant by the start of the semester, if you are coming from abroad, from a country that doesn't have access to a WHO listed vaccine, getting that first dose of vaccine will put you in at least partial compliance, which will allow you to go to class. Unfortunately, it's a little bit more challenging for us to segregate the follow-up lists. I know that's can be disconcerting to get the emails saying that you're still not in compliance. But again, we are trying to make provisions for the international students who are coming at the start of the semester unvaccinated, so that they can engage in classes. Let me check back again. Anything else that's come up in the chat that we want to address? I do want to highlight, though, the importance of Dr. Langford's part of the session this morning, because things do change so quickly. And certainly we make a concerted effort to, through public affairs, to communicate out through emails, updating the website, social media, changing conditions, changing protocols. But at the end of the day, I think there's also opportunity for each of you to ensure that you're finding good, accurate information as things do evolve. Because again, I think the headlines are the headlines and sometimes don't always address some of the nuances and sometimes can be a little scarier than they need to be. So again, very critical that all of us can be discerning like that and find good, accurate health information. Let me just go back. Just in terms of, I know a lot of people are curious, going back to the issue of herd immunity and where the NYU community is, how many exemptions there are. So we have had a limited number of exemptions so far. So again, people have applied for both medical and religious exemptions. And again, we have approved both for students and employees, a limited number of those. I think the overall community, we're headed in a good direction. The employee deadline for uploading the information is, I believe, August 1st, which is coming up in a few days. I think subsequent to that deadline, we will, I think, put out an initial communication and let people know where we are. As I said before, particularly with what we're seeing and some of the emerging data even this week about how transmissible the Delta virus is, we're really looking for that highest level of coverage, which is why we have the vaccine requirement. So more to come on that, I think, once we have all of those data points uploaded and validated. There is a team that is manually looking at the records to ensure that they have all the information that they need. It's the right vaccines, the right timing, that it's 2 weeks after the second dose before validating. So some of that is still happening.
Great. And can you just mention where, I think it was said early at the beginning, but where follow-up information, if people have questions that weren't answered or they want information related to the things that we talked about today, where on NYU's website or I guess Student Health, where can they go? Because there's a lot of questions that we couldn't get to.
Correct. There is a COVID hub, which is on, and I still think it is on the landing page. I know there is a specific FAQ page. I don't know if anyone has that link handy, but certainly if you go to NYU's landing page,
Okay.
you will see the, thank you, Monique. So it is now in the chat, again, which has information about the vaccines, questions, support. So again, we did get quite a few questions, could not answer them all, but that's an initial place to look for some additional information. So a couple of links there for both general COVID information and on the vaccines.
Thank you so much, Dr. Ciotoli. Thank you also, Dr. Langford, for being with us this morning, for your presentations, and also for answering the questions, some of the questions that have come up in the chat. We do apologize. This webinar is scheduled for 1 hour, that we were not able to get to all of the questions that have been posted. We thank you all for participating in this. We know that these are really good questions that you've had, and you may still wish to get answers to some of them. And there is a team that works under Dr. Ciotoli, which is the COVID prevention team. And it is important that you all know that we have a whole group of people who have been working on this effort. They continue to work on this effort. And if you continue to have questions, they are a good source of information. Also, just want to draw your attention to NYU Returns. We continue to post updates on the website. So please, if you've not checked that, please do so. The messages that go out to the NYU community are immediately posted to the NYU Returns Hub, and that continues to be the authoritative resource, on all of our current statuses as it relates to our policies and also our return to campus activity. So we wish everyone a great weekend, and we hope that for those of you who have not been able to move toward compliance with the policy, that you will be able to do so, and we encourage you to do so. And again, we thank you for participating in the webinar this morning. Take care all.